Are you addicted to pan, zarda और गुटखा, betel nuts or quids? क्या आपकी जुबान में कोई घाव है? You are having tongue ulcer. You are having ulcer in anywhere of your oral cavity. Beware. We can see lots of our heroes promoting these things, but ज़्यादा दिन तक अगर इससे प्यार करेंगे तो आपके जुबान कुछ बोलने के हालत में नहीं रहेगा. Hello friends. This is Dr. Arghya Basu, gastro and cancer surgeon, welcoming you all to a very interesting episode of your own YouTube channel Arghya, where we discuss various gastro, cancer and surgery related problems and try to help our patients and viewers with accurate and state-of-the-art medical guidance, even at personal level. Always remember that whenever you are addicted to pan, zarda or gutkha and you are chewing it for a long time, that substance will have a prolonged residual effect on your entire oral hygiene, oral microbial flora and oral mucosa for the rest of your life. So, अगर आपने वो छोड़ भी दिया, don't get into the sense of false security जी कि हमको मुंह का कैंसर नहीं होगा. It can appear, it can occur anytime in your lifetime. So, the thing is, you can get oral cancer in the form of an oral ulcer at an early stage at any part of your oral cavity, which can be seen from outside, like your gum, your tongue, floor of your mouth, your lips, your palates. Even these things can occur in your upper aerodigestive tract, that is the posterior part or back part of your oral cavity, which you cannot see, but you will just feel intense pain in your tonsils, in your neck. Even tonsillar cancers can produce severe pain, and the most important other symptom that the patients suffer from are glandular swellings in the neck, which we medically call cervical lymphadenopathy. Often the primary cancer inside the oral cavity is invisible, it cannot be seen, it is hidden inside the vestibules, I mean the folds of oral cavity, and only the cervical enlarged lymph nodes are visible. You are having enlarged lymph node in one of the sides or both the sides of your neck or even the posterior part of the neck. So, beware, this is a silent killer and this is a pathetic killer, because oral cancers, if they are locally advanced, they cannot be treated beyond the scope of any surgery. They push the patient to a pathetic lifestyle, to a pathetic quality of life. Please listen to the video till the very end so that you don't miss any vital point, and at last, where I will share with you the links how you can get in touch with me and get personalized advice and guidance. Now we will go to the treatment and further discussions part, but before that, if you are enjoying the show and अगर आपको कोई benefit मिल रहा है तो please ये चैनल को सब्सक्राइब कर लीजिए and बेल आइकॉन को प्रेस कर दीजिए, so that you will get notification every time we post a video, and this will give me and my team a huge inspiration for our hard work. Thank you. Now, without any further delay, let's dive deep into the problem and how we are going to tackle it. First of all, if you are having a buccal mucosa cancer and if it is locally advanced, the patient will have one opening or one ulcer in the exterior of the cheek. After a few days, there will be a communication through the exterior of the mouth and the internal aspect of the mouth, through which saliva will come out of your oral cavity into the exteriors. You will have dribbling of saliva through a pore in your cheek. मैं आपको डरा नहीं रहा हूँ, मैं आपको चेतावनी दे रहा हूँ. अगर ऐसा कुछ हो रहा है, please visit your oncologist at an earliest. The other common thing that I face in my OPD is that people come to me with a complaint that Dr. Sahab गए थे dentist के पास for a dental extraction, and after I had that dental extraction, after 2 months I saw an ulcer growth in the gum जहाँ से हमने दांत उखाड़े थे. So दांत उखाड़े थे, इसी के लिए मेरे को कैंसर हुआ है. but this is not at all true. The basic fact is, whenever you are having a cancer of your gum, it eventually makes your teeth of the affected side loose, and you tend to have pain at the root of those teeth. So, patients cannot feel a growth in their gum, but what they can feel is the intense pain they are having at the root of their teeth, and they take it to be arising out of a carious tooth. So, they go for dental extraction. After dental extraction, many of the dental surgeons do not have exposure of cancer surgery or oral cancers. तो दांत तो उखाड़ देते हैं, लेकिन उसके बाद नीचे का जो टिश्यू विजिबल होता है वहाँ से they tend to forget to take biopsies because the growth is often small at that stage. After a few months, when the growth enlarges, it becomes visible, it starts bleeding because the upper part of the growth is now empty and which was previously covered by teeth, and now the ulcer becomes visible and the patient thinks I am having oral cancer out of dental extraction. So, dental extraction is not the cause, it was just a hiding factor for the cancer. It does not cause cancer, but beware, whenever you are having a loose teeth or pain associated at the root of the teeth, immediately visit your oncologist. These type of cancers can occur anywhere in the mouth, and the treatment varies from minor biopsy and minor surgery to a very big commando surgery, which is involving removal of upper palate or maxilla, lower gum or mandible, and putting in a tracheostomy or a temporary respiratory tube, and then reconstruction using your tongue, using flesh from elsewhere in the body, like from your thigh, like from your chest wall, or free flaps, taking a free fibular graft and reconstructing this defect, so on and so forth. These are all technical terms, I am not going into technicalities. The thing is, यहाँ पे गड्ढा खोदना है सर्जन को और उसका भरपाई भी करना है, which usually takes considerable amount of plastic surgical skills, and it is the face of a person which bears the maximum cosmetic effect. Therefore, the surgeries of oral cancers are extremely challenging. We have to cut it and we have to reconstruct it as well, and as good as reconstruction you do, the patient will always have a regret कि मेरा मुंह जैसा था वैसा तो नहीं रहा, change हो गया. But the thing is, fellows, here we are trying to save your life, not giving you a cosmetic appearance so that you can act in a movie. We are trying to save you and your family, and at the end of the treatment, if you are getting a successful, productive, healthy life, be happy with it. Try to use it properly. Don't criticize, don't regret. Live your life. Very small number of people actually can survive through cancer in third world countries like ours, because although cancer is totally curable until third stage, very few persons are that aware and they come to an oncologist at an earlier stage. In most of the cases, people come to us with a very advanced disease where it is beyond any scope of surgery, where we can just give the patient a few cycles of palliative chemotherapy or palliative radiation and put the patient on palliative care. So, do not go up to that extent. Whenever you are seeing an ulcer in any part of your oral cavity, please visit your oncologist or visit a surgeon, get a biopsy done, and if the biopsy is a cancerous one, then immediately visit a surgical oncologist or at least an oncologist so that you can get some chemotherapy or some surgery or some radiation or integrated treatment to save yourself as well as your family. In oral cancers, usually we operate first, then put the patient on radiation therapy. The role of chemotherapy in a totally treatable oral cancer is not well established yet now. However, many trials are coming up where some neoadjuvant chemotherapy Neoadjuvant means the chemotherapy that we administer before performing the operation is actually coming up. And in my practice, I have seen enormous role of neoadjuvant chemotherapy in oral cancers as well. Often we use a few cycles of neoadjuvant chemotherapy to downstage and downsize the cancer. We shrink the cancer so that the operation becomes easier, the surgeon's life becomes a cakewalk, reconstruction becomes easier, but even after that cakewalk, we have to give the patient a full dose of radiation. The role of chemotherapy after surgery in oral cancers is limited. It is usually given to palliative patients. Palliative means when the disease has already spread to different other organs of the body, where we cannot remove the cancer totally from the patient's body. However, we are trying to give the patient a productive life for the rest of her life, so that he can enjoy his or her life with his or her family for the rest of his or her days, with the help of some sort of chemotherapy, immunotherapy and other sorts of chemotherapies, but those are only on palliative settings. So, do not go up to that level. Whenever you are suspecting a oral ulcer or oral cancer, immediately visit your oncologist. All oral ulcers are not cancerous. There are lots of oral lesions which are not cancerous, but do not be satisfied with this word. Immediately stop all your oral addictions, live a addiction free life, so that you can live your entire life with your family happily, a reproductive life that all of us want at the end of the day. You can get connected with me and follow my posts, videos and blogs in my social handles given in the description box just below. If you want a personal consultation with me, please WhatsApp or call in the following numbers. My team members will personally get in touch with you as soon as possible.